Hello, everyone. Thank you for joining us today. We're going to get started in just a few minutes and allow everyone a chance to log in.
Can I get out and in very quickly?
Hello, everyone. Thank you so much for joining us today. We're going to go ahead and get started, and I'll hand it off to our Executive Director, Laurent Hubert.
Welcome to this fourth and penultimate of a series of webinars for the public health community that we're having and holding this week, which is the week that the Framework Convention on Tobacco Control Negotiations, COP9, were scheduled to take place. And next week would have been the Illicit Trade Protocol meeting of the parties. But both have been unfortunately postponed until 2022 to the COVID-19 pandemic. Today's webinar focuses on COVID-19's impact on the FCTC, the importance of cessation in the context of COVID, and how have tobacco control policies advanced at country level, or what have been the challenges at country level. So today's webinar is co-hosted by ASH, the International Center for Tobacco Cessation, and nofumadores.org in Spain. ASH has been intimately involved with all of the FCTC negotiations and the FCTC process, so it's an honor and privilege for us to be involved in this process and moderate this discussion today. We'll have three great speakers today. Before I introduce them, a very quick housekeeping issue. There will be plenty of time for Q&A after the presentations. You can start tapping them now in the Q&A box. There's like two little bubbles with a Q&A next to it. And you can start typing questions and free to direct them to any of the speakers. Note also that PowerPoints will be made available to anyone who's registered for the webinar after the webinar. So I'm going to welcome our first panelist. We're very, very honored to have Doctora Adriana Blanco Marquizo, who's the head of the Secretariat for the Framework Convention on Tobacco Control. And she will discuss the intersection between the FCTC and COVID-19. Adriana, please go ahead.
Thank you very much, Laurent. Well, this is really a very good opportunity to speak about this. We know, as you said, COVID has deranged our plans for COP and MOP this year, and we are planning to have them by the end of next year, and still we are beginning to feel uncomfortable about this is going to be possible or not, as we see in the pandemic in this moment. So first slide, please. Well, I think that these issues are more than well known by everyone about the amount of people that is killed by tobacco annually globally. That each day 22,000 people were dying in the world, both from tobacco use or tobacco exposure. And really, this, even though we have a treaty that has been in force for 15 years, the work in tobacco is far for being done. And really, we know these things keep on going, and in business as usual, the amount of people that is going to die in this century is really enormous. Next slide, please. But we think about tobacco as a health issue, and it is a health issue, but really we need to see it in the bigger picture of a development issue, because really there are many other dimensions that tobacco impact the social dimension, impacts the economic dimension, and impact the environment dimension. And this last one usually is one of the less well understood of this, but really, if we are thinking as gracefully many of the leaders are thinking now in a build back better strategies to get back from this horrible situation of the pandemic, thinking about the environment is something that is embedded in many of the plans of the countries. So tobacco control will also contribute to this. Next slide, please. We know that from the health perspective, tobacco is risk factor for the 4 major non-communicable diseases, and we know that this is the bigger killer in the world that kills about 70% of the people who die. And really, I like to think in NCDs as a slow motion pandemic, because I think we always talk about the epidemic, but really NCDs and tobacco use are pandemics because they affect all countries in the world. So really the intersection of these two pandemics, and people is now talking about as endemic, it is really unfortunately, and one is giving a negative feedback on the other. Next slide, please. Okay, so as I said, we have since the last 15 years legally binding global treaty that now has 182 parties. That is the Framework Convention on the WHO Framework Convention on Tobacco Control. We have now, as I said, 182 parties, and really many of the parties has implemented their mandates, but really is an uneven situation regarding both countries and some of the measures. Next slide, please. And we also, now we have, let's say the WHO FCTC has a baby, that is the protocol to eliminate illicit trade on tobacco products that has been in force for the last 2 years and has already 62 parties currently. And why a protocol on illicit trade is because illicit trade really undermines many of the most effective measures on tobacco control, because it puts the cheap tobacco at the disposal of people. And for example, the most effective measure that we have in tobacco control, that is raising taxes, unfortunately is undermined when you have availability of cheap products in the market. Next one, please. So as I said, tobacco is an issue of development, and the countries so accepted because when they decided about the SDGs targets and goals and targets, inside the goal, SDG Goal 3, and specifically the 3.4, that is well-being and health and well-being for everyone, we have a target, the 3.8, that specifically call for strengthening the implementation of the FCTC. Next slide, please. Okay, so we have many tools really that to help in many of the areas that tobacco impacts. So as I said, we have this target in the SDGs. We have analysis of how tobacco can help the achievement of other targets, not only the target in health. It can help in decreasing poverty. It can help in decent work. It can help in the environment, as I said before. Also, the Conference of the Parties have approved in the last COP, in the COP 8, a plan to accelerate the implementation of the FCTC, because as I said, the implementation is very heterogeneous. There are not all the countries has implemented as many measures as they should, and in the measure, for example, Article 6, the tobacco taxes, is one of the measures that really has been less implemented. The same with the total ban on advertising, promotion, on sponsorship, and also with the implementation of Article 5.3. Next slide, please. Okay, so why we are, let's say, concerned about this endemic, let's say the NCDs and the tobacco and the COVID? Well, we know that people with underlying conditions that usually are NCDs has a higher vulnerability, for COVID-19 and an increased risk of disease and death. And we also know that the smokers, when they get the infection, they have a worse prognosis than non-smokers. So that is why we think that tobacco control should be part of the current strategies to cope with the pandemic, and also of the strategies for recovery after this has subsided. Next slide, please. Okay, so we know that the implementation of the FCTC should be integral if we want to get the best result of it. But now I would like to make a point on some of the articles that I think that are specifically important in this moment. And for example, Article 14, that is cessation, and I'm not going to extend here because we have Martin that is going to present of this, but it has never been a better moment to offer support for quitting when the people is much more aware of health than before. Article 6, because with Article 6 we can shot two birds with the same stone. I think it's the same, because in one side we can decrease tobacco consumption, and in the other hand we can increase the governmental revenue that is so needed in this moment after the pandemic. Then we need to consider Article 5.3 and Article 13, because this Article 5.3, as you know, is the one who deals with the interference of the tobacco industry, and Article 13 specifically because as part of the wide prohibition that we should implement under Article 13 is the ban on activities of social responsibility corporate interventions. That we know that it is just a game of the industry to try to clean its tarnished image, trying to provide help in moments of problem. And last but not least, I always mention Article 8, smoke-free environment, and Article 11, that is graphic warnings, because that is part of the things that are in the portfolio of the Ministry of Health. That is why I say that this is something that the Ministry of Health has the mandate to do, and they should do it. And in many countries, they have done it by a decree, let's say by an executive order, and not waiting for a law, because this is in the portfolio of the Ministry of Health. Next slide, please. Well, as I said, the tobacco industry is, as always, taking advantage of it. You can see in the pictures that are behind, they have been providing equipment to protect the people. They have been providing ventilators. They are working currently in a vaccine with an enterprise from Canada that is 3/3 owned by Philip Morris. So we know you have here in the screen the things that the Article 5.3 guidelines request. Next slide, please. So these are resources that I just leave in the PPT, so you can access to them. It's resources of various sources. Next slide, please. Here are a list of things that have been happening, because we think that the countries are not paying attention to tobacco control, but still we have one more party to the FCTC, what we didn't expect at the moment. Andorra became party. We have many parties passing legislation or working on different policies, and we have many new parties to the protocol. Next slide, please. Okay, these are the updates of the expert groups. It's the same. I'm not going to read the slide. Next slide, please. And again, we have other resources coming. We have launched virtual need assessment in the countries when we thought that we will never be able to provide this kind of service to the countries. We have been doing them virtually, and you see all the resources that are there. Next slide. And well, last and really not least, I want to underline the important contribution that civil society has provided to the whole development of the FCTC and the implementation of the measures, and that is important that as many international civil society organizations request observer status to the court. and do them all. Next slide, please. And well, that is all. Thank you very much, and I'm here for the question that you may have. Thank you.
Thank you very much for this status update on with the FCTC and what countries are doing, as well as some of the challenges posed by the industry interference and resources available. We'll get back with questions soon to you. And again, I remind everyone, if you have questions, you can start typing them in the Q&A. Our next speaker is Martin Rowe. He's the director of the International Center for Tobacco Cessation, ICTC, and a visiting professor at NYU, New York University, School of Global Public Health in New York. And he will present on how cessation services can mitigate the negative impacts of both the tobacco and COVID-19 epidemics, pandemics, actually. Martin, please go ahead.
There are very good reasons for tobacco users to try and stop smoking during this pandemic. WHO say that smokers who contract COVID are more likely to get severe symptoms. There are some data from the UK that suggests that non-COVID related deaths are higher than would be expected on normal trends, which is to be expected if health services are being diverted away from non-COVID related illness. And then there are other factors, many other factors that will increase the risks of illness for tobacco users. For example, raised blood pressure, people who already have lung disease and cancer, and so on. So we have some data on cessation during COVID. Obviously, it's early days in terms of how COVID is affecting cessation, and it'll be some time before we know how it affects cessation patterns, but we do have some data from some countries that may be helpful. The data I'm reporting on this slide are from the UK. They're published in Addiction. Obviously, they can't be applied globally, and they're self-report data, but they do give us some idea as to what's going on. So compared to data from the same period last year, during lockdown, smokers were more likely to try to stop smoking, and they were more likely to succeed in stopping. We're not quite clear what proportion of these attempts were actually triggered by lockdown. But anyway, we do have an increase in cessation attempts and cessation success. In the same UK study, the proportion of smokers that use support to try to stop did not change because of lockdown. It remained at approximately 50%, 50. However, the proportion that used remote support, not surprisingly, rose from 2.7% to 10.9%. That would be quit lines, text messaging, mobile apps, and websites. Not surprising, of course, because of the difficulty of face-to-face healthcare during the pandemic. So, in terms of cessation data and COVID, what are our conclusions so far? One is that COVID and its associated lockdowns are prompting many tobacco users to try to stop. It's probably increasing their motivation to do so as well because of the severe health consequences. But obviously, by the very nature of the pandemic, face-to-face support will be much more difficult to access. So, what is available globally, and can we do anything quickly to help? With a focus obviously on support that involves minimal face-to-face contact. And the obvious candidates, as already mentioned, are mobile apps, including, including text messaging, quit lines, websites, medicines, including nicotine replacement, and cytosine. And I'll mention a few words about cytosine in a minute. So moving on then to some of the things we might be focusing on cessation now. And the first one is encouraging health professionals not to use tobacco, and encouraging them to give up and to seek support. These are very, these are very old data, but they do show some alarmingly high smoking rates in health professionals. For example, nearly 50% of Slovakian GPs smoking. But they are old data, and our group did a systematic survey of the literature more recently, and the findings are summarized on this slide. Nearly 230 studies representing almost 500,000 healthcare workers in 63 countries. The overall conclusion is that tobacco use is still an issue in healthcare workers. The overall average was 21%, but there are some very high figures there, 35 and 45% in male doctors in middle-income countries. So I think this is one area that we should continue looking at. We should never have stopped, but I think it remains important. Secondly, then, in terms of interventions that don't require face-to-face support, medicines are potentially going to be very, very important. This slide shows quite good overall access to medications, especially nicotine replacement, although as expected, there's an income gradient, so much less available in low-income countries. Cytosine is a naturally occurring substance from the laburnum plant. It grows in most climates and has been used in Europe, mostly Eastern Europe, for 70 years. It's potentially very, very useful because it only costs $15 to $20 for a full treatment course, and it's effective and safe. Unfortunately, it's only licensed in about 30 countries. One other point about medicines. A recent published study in addiction shows that only 25% of countries have even one of the stop smoking medications on their national essential medicines list. These data are from our global survey, again showing very, very poor provision of telephone helplines and text messaging overall. And that's 23% and 17% of countries that offer free national telephone helpline and text messaging. So what can we do to make the most of the current situation? I think we should increase our efforts to persuade and help healthcare workers to stop using tobacco. We should promote cessation support in publicity material. There must be a huge amount of publicity material now going out about COVID and tobacco cessation. Let's remember the material to encourage tobacco users to look for support, and especially text messaging, quick lines, and affordable messages, medicine, sorry. But my final message is that we also need to reset our whole approach to implementing FCTC Article 14. And we need to go back to basics and take more seriously the implementation of the article guidelines, and implement them more vigorously and more urgently. There's various data showing that implementation of 14 is lagging behind others. And there are resources to help tobacco users stop. Here are some of the resources: the Article 14 itself and its guidelines. A set of tools have been developed to implement Article 14, and this is to help countries improve their treatment. I've listed them there. The affordability calculator is an Excel spreadsheet which countries can use to input their national data in order to work out what is most affordable, what is, if you like, the best buy for them on cessation. The point there is that there are low-cost, broad-reach approaches which can be implemented now. There's also a library of national cessation strategies and national treatment guidelines. There are the surveys we did of our global survey of treatment provision, and so on. Most of these materials are on treattobacco.net. There is the home page of that website with, at the middle, at the top, a section on tools to implement Article 14. Almost all of the tools I've mentioned are on the site. And as I said, they include tools, those tools I've just mentioned to implement the guidelines. And they include some national cessation strategies, a library of national cessation guidelines, and some case studies. So that's it. Thank you very much indeed. I'm very happy to respond to questions by email as well as in the Q&A, and to send people resources or links if they can't find them on that website. Thank you very much.
Thank you very much, Martin, for presenting the fact that one is Article 14 cessation has been somehow neglected so far. The opportunity it provides in the context of COVID-19 and resources available. And we'll dive into it a little more during the Q&A section. I will introduce our last speaker, Raquel Fernandez Mejina, who's the president of nofumadores.org in Spain. And she will give a real world example of how in Spain, civil society managed to take advantage of the situation to actually push and further tobacco control. Raquel, please go ahead. Raquel, you're muted.
Sorry. Can you see my screen? No, wait. There you go. Can you? Can you see the screen?
Yes,
Yes?
we see.
Okay. Okay, good. Okay. What? There you go. Wait. There.
Perfect.
Okay, well, to start with, thank you, Lauren, for introducing me. And thank you, As, for letting me be part of this webinar. I'm going to explain you how to use the COVID-19 pandemic situation to advance tobacco control policies and what we did in Spain. Well, to start with, I want to explain you which was the situation in Spain pre-COVID. In January, a new health minister took office, and in February, he gathered all the tobacco control community to announce to us his intention to renew the actual tobacco law in Spain, which is from 2010, in order to introduce new measures to fight tobacco use, and also to hear what we thought it must be done in this aspect. Then the pandemic came and everything stopped, but since the very beginning of the lockdown, nofumadores.org realized we couldn't let pass the opportunity to keep fighting against the tobacco pandemic because the tobacco industry, as Adriana said before, was certainly not going to stop using the pandemic for their own interests. We all remember the studies stating that nicotine was good for not to get infected by the virus. So we used any chance we could to remind the society and the government that tobacco had to be kept in mind if we wanted to win the battle against COVID-19. So these were the actions taken in nofumadores.org. As I say, in March was the lockdown, and in Spain, the tobacco stores kept open during this time. So we couldn't understand how tobacco could be declared essential service. So we started a campaign in change.org to collect signatures to stop the sale of tobacco during the state of alarm. Also, we sent 2 press releases regarding this matter that meant 10 digital newspaper appearances. See, media is a great tool to create public opinion and to be heard, not only by the society, but also by the politicians. Here are some of the headlines we got with those 2 press releases. We delivered the signatures to the Ministry of Health. By the time we did it, it was the end of May, so we didn't really got our goal because by the time we gathered all those signatures, it was the reopening had started. But we got a reply from the Minister of Health stating that the government was committed to reduce smoking remaining intact. So in May, the reopening started, and we saw the need to keep in mind tobacco policies during this period. So we decided to send a letter to the health minister and the president of Spain, even though most of the tobacco control community thought it wasn't the right time. Luckily, we did have the support of ENSP, FICAP, which is the Nurses Association in Spain, and to the Law for Air Association. In the letter, we asked to include within the reopening measures the banning of smoking and vaping in outdoor dining areas, because taking immediate measures against smoking and electronic cigarettes will contribute to, first, reducing the chance of infection of COVID-19, reducing a factor that worsens the possibility of treatment and prognosis of the disease, reducing the pressure on the health system, helping to denormalize tobacco, saving thousands of lives, and helping the reduction of environmental pollution. So we got a reply from the president's cabinet and also from the health minister, stating that the consideration we made in our letters provide them help to adopt short and medium-term measures that we will see later on the presentation. So in July and August was the new normal period, and we decided to demand to declare outdoor dining areas smoke and vapor free. For that, we made a manifest, and this time we got the support from other entities in the tobacco control community. Right then, we got the support of 20 of them. Right now, we are 37. So together with that, we started again another campaign in change.org, asking for smoke-free outdoor dining areas. So together with this, again, we sent 7 press releases for all this period. Here are some of the headlines. As you can see, we sent a couple of them in May, another in June, a couple in July, a couple in August. So the idea was to send one of them every 15 days or something like that. That supposed 43 digital newspaper appearances, which is, you could see we were in the newspapers quite often. So also in July 28th, the manifesto was delivered to the health minister and the president's cabinet. In August 12th, it was delivered to the public health directors of the 17 regional governments in Spain. And by August 13th, 94,000 signatures collected in that moment in the campaign Smoke-Free Outdoor Dining areas were sent to the Minister of Health and to all regional presidents. Again, we got a reply from the health minister, so that really shows you that we were really being heard. And on the minister's reply, he agreed that smoking prevention and control measures had to be part of the response given to this disease, and that the health authorities had approved a document stating their stance related to tobacco and related products consumption during the COVID-19 pandemic. He also recognized the important contribution of our entity and the rest of signatories of the manifesto in the fulfillment of these agreements and adoption of the measures which have been achieved so far. So we reached September, and it was the back to school time. And then we decided to demand to establish a 10-meter security perimeter at the school entrance and university campuses. We did it through a press release that meant that we were in 14 digital newspapers, and also through an official request to all regional presidents. As a result of this, we saw that the political party box sent a parliamentary question to the Congress asking to the government of Spain if they had considered to ban, to set a smoke-free perimeter at the entrance of schools and university centers. And if so, when? Besides this previous example, we launched an aggressive media campaign to keep tobacco restrictions at the forefront of people's mind and in the political agenda. Here are a few of the headlines from that campaign. You could see we were in the media quite often. So recap of our media campaigns in all this period of time. We sent out 16 press releases, 95 appearances in digital newspapers, 8 radio interviews, and 6 interviews on TV. As a result of all these actions, we got to see the establishment of smoke-free outdoor spaces. In August 12, Galicia, a region in the north of Spain, banned smoking on the street and outdoor dining areas if safety distance couldn't be guaranteed. Only problem here that we saw, even though we were really happy for this news, it was that safety distance was established in 2 meters long, 2 meters distance, 2 meters apart, and we thought that wasn't enough. Anyhow, 2 days later, the measure was expanded to the rest of the country. The health minister himself announced the measure in agreement with all the regional governments. Also, in August 23rd, Cantabria, another region in the north of Spain, implement the smoke-free beaches project by banning smoking in their beaches. In August 26th, the Balearic Island established a smoking ban in any public space, regardless the distance between people. In October 10, Canary Island banned smoking while walking in the street. In October 16, Castilla y León, another of our regions, banned smoking on outdoor dining and also in the street when 2 meters of distance couldn't be guaranteed. Also, on October 29th, the health minister gathered all the tobacco community again in an online meeting to announce that they are working on the update of the tobacco law, and that they will include the ban of tobacco and vaping use in outdoor dining areas, which we consider as success, since in our February meeting, only nofumadores.org was demanding this measure, and in this occasion, the whole tobacco control committee demanded it. And here you have my conclusions. Don't let anyone tell you this is not the right moment to bring up tobacco issues, because we are in the middle of a crisis and the government has their hands full. Big tobacco won't have those considerations and will use the pandemic to misinform the public. Look at the COVID-19 pandemic as an opportunity to work on tobacco control measures and be persistent. You have to be like the drop that forms the stalagmite. So thank you all, and I'll be happy to answer your questions later on.
Thank you, Raquel, for sharing this Spanish experience and taking advantage of the COVID-19 situation, despite being a challenge, making an opportunity out of it. So we will go straight to the Q&A section. Again, I remember and ask you to type your question in the Q&A box bubble. That's, for me at least, it's at the bottom of the screen. The very first question comes from Judith Mackay, and it's addressed to Adriana Blanco, but maybe the other speakers also may want to bring into add to it. But she suggests that there be a unified effort to integrate tobacco in the UN General's Interagency COVID-19 Response and Recovery Fund. Currently, only 3 out of 62 countries with national plans even mention tobacco control. And those are Bahrain, Jordan, and Saudi Arabia. We must explain to the UN, governments, and civil societies that tobacco control is integral to the COVID response. And I could not agree more with Judith, because I noted that also that the report from the special rapporteur on the right to health to the UN did not mention tobacco in the context of COVID-19. So this was the COVID-19 report. So I would like to hear what Adriana and Martin and others have to say, but particularly coming from also from the Secretariat. How do we encourage governments to really use the FCTC and COVID-19 as a critical element to the COVID-19 response?
I totally agree with the comment, and we have tried to include this even when there was the discussion in the United Nations General Assembly of the past resolution on COVID. We had a virtual meeting with the key facilitators of the resolution, and there is one point in the resolution, if you go there, that is a paragraph like this big, and it names, I don't know how many political declarations, treaties, everything. And so we asked only to put there the FCTC, since the FCTC since tobacco is important, and we couldn't. There were some countries that were objecting it, and since they wanted to pass the resolution, they prefer not to fight for this because it's going to be difficult. In every time I can have opportunity to talk about this. Today I make an intervention in the World Health Assembly, and I repeat that tobacco needs to be an integral part of the building of the recovery projects. But it still is difficult. The governments don't see the necessity of including tobacco. So I think that now we should go like Raquel that said we need to be the drop that, or it's the rock, because really it's very difficult to put in the minds of the decision makers.
Thank you for that response. It's like we do have more to do then in order to encourage for that integration to be made. The next question I have is in the context of Cessation. Why is it only available in about 30 countries, given that it's a fairly affordable product and has proven its effectiveness? Well, the question was asked to WHO first. I suspect that actually Martin Raw might be in a very good position to answer that. And I do know that NRTs, for example, are among essential medicines. But can you address, Martin, why Cessation is having a hard time making it to the to smokers who want to quit?
It's potentially a long and complicated answer, but the quick answer is that governments need to be fast tracking the licensing using data already available. And there are 70 years worth of data with efficacy and safety data from the European Union. So the quick answer is it's simply not on people's radar so far. It originates historically from Eastern Europe. And I suppose the other half of that answer is that medicines licensing authorities do tend to be very, very slow and bureaucratic and very cautious in their licensing new medicines.
Which is ironic because in this context, the cessation product is having a harder time to make it into the market than the tobacco products do in many cases.
One quick point there, it is so cheap, potentially, that it wouldn't even need to be offered as a prescription. People could just go and buy it. It's much, much cheaper than a month's worth of smoking or tobacco use in many countries.
Great, thanks. Then a question that probably is better addressed to Raquel. As you were implementing this campaign in Spain and pushing for banning speaks in outdoor places and the cafes, restaurants, and in public places to avoid even potential transmission of COVID. What kind of resistance did you find? Where was the opposition to move toward that extension into all outdoor places, or did you find it to be a fairly easy win in the context of COVID?
Do you hear me?
Yes. We hear
Okay. Okay. Actually, it hasn't been. We are in the moment when society understand health comes first, and it hasn't been really social rejections to these measures taken in smoke-free outdoor areas. And I think there's a big support of the society. It's hard to implement in full. There's always people who are not going to respect it, who's not going to follow the rule, but that happens in any aspect of the life. I mean, you know, when driving, there are people who speed. So, but I think the problem here is those 2 meters apart. It's difficult for a person to approach someone else and tell him, oh, you are not supposed here because you are not 2 meters apart from me. I think that that makes it difficult to ask other people because obviously there's no police enough to go after every smoker who doesn't follow the rule. But if we can ban those 2 meter distance, if we can get a rule like in Balearic Island when you cannot smoke anywhere, it's easier to implement, and it will be easier to the owners of restaurants and bars to have outdoor dining areas, because they wouldn't have to confront their clients so openly. So I think in global, the answer has been good. And we really hope to keep this, obviously, once the COVID passed, we don't really expect that smoke will be banned from everywhere in the street. But I think we should really amplify the number of areas that should be smoke-free outdoors, like dining areas.
And what I've noticed from what I've seen in the Balearic Island is it seemed to be enforced from what I've seen in outdoor restaurants and places. And I've seen some local police officers in the street where someone was smoking, in some cases, mentioning and asked them politely to no longer smoke, or in some cases it being ignored. I've seen a mixture of both. The next question was posed to Dr. Blanco, but others also may want to add to it. And it's in the context of the progress being made in tobacco control during the pandemic. But we'd like to know about the argument recently expressed in the Lancet and elsewhere that it's the perfect time to wind down or eliminate or phase out tobacco industry or some of the tobacco products, as the ongoing tobacco death toll is greater than the pandemic toll. Adriana, what are your thoughts on that and the other speakers in the context of?
My idea is that, of course, that phase out tobacco will be a great idea, but I don't think we are there yet. When you have an addictive product and you have still places where you have a big percentage of the population that use that product, it's difficult to phase it out in a quick way. Perhaps it can begin to be an idea of those countries that have decreased the prevalence probably to 1 digit, and they want to finally find the 5% that we consider that the end game. But I think it still is difficult. Still, there is too many countries that have done almost nothing, even though they are parties to the FCTC, and they need to move a little more ahead, because it will be a big jump. For some countries that are much more advanced, perhaps it's time to begin to make the plans in a long term, because it's nothing that can happen from the night to the day, to begin these plans that usually are known as endgames.
I'll get back to this for the other speakers, because there's a specific question to Spain. But before I get to it, also maybe for Adriana, How do we maximize on where we are right now to really promote the concept of using Article 6, for example, and fiscal policies as part of the recovery in the context of a global economy that will need to recover not only from a health pandemic, but also an economic crisis. So how do we successfully encourage country to really maximize on Article 6 and that tool, which can really help with generating funding, resources for health systems, and so on and so forth?
I think that there are two parts. One is that we need to show numbers. We need to help them to make simulations. Okay, if I increase the taxes in that amount, how much I will get of money of the taxes, and how many fewer cases of fewer smokers I will have. But the other thing that countries can think is that even though the increasing money from the tobacco taxes may be something in the medium term, because in the long term, you're supposed that you are going to decrease really the prevalence in a substantive way. But the other thing that they need to see is the future saving that they are having when they don't have so many people with NCDs. And this is a huge saving that perhaps countries don't see, but for in this moment that we are trying to get universal health coverage and access is really fundamental to cut the entrance of new diseases if we want to provide everyone with care. The second thing is countries also need to ratify the protocol, because so we take out from the industry this phantom that they put in the minds of the government that increases taxes equally to increase the illicit trade. We know that differentials of price is an incentive for illicit trade, but it's not the cost, okay? Because we have countries with very high taxes that have very little illicit trade and the other way around. So it's important that more countries become parties to the protocol, so really this can be a global network of the countries preventing the same tobacco industry in many cases to introduce products that will be cheap through the illicit channels in the world.
Thank you, Adriana. So I have a follow-up question that will go maybe more to Raquel. And it's in the context of both the taxing issue and also the point being made earlier of is it the time to wind down the sales of tobacco products? And one of the attendees asked to Raquel, do you think Spain is ready for Article 2.1? And this is the article that states that the FCTC is the floor and not the ceiling, and encourages countries to go beyond the articles in the FCTC to protect the health of their ceiling, of their citizens. So basically less selling points in Spain. Sounds like you have a lot of support from the population and a ministry that is responsive. So I'm going to ask if you think Spain is in a position to maybe move towards this, but at the same time, how do you do that in the challenge where actually Spain has not maximized on implementing Article 6 of the FCTC, given that I know the taxes in Spain are still relatively slow if you compare to France, UK, on tobacco products. And unfortunately in Spain, we find some fairly cheap tobacco products and fairly cheap cigarettes. If you could expand on that, Raquel.
Yeah, well, to start with, in that meeting we did have with the minister, he told us they are working on raising the taxes on tobacco. So hopefully that will arrive soon. So of course, not only in Spain, but I think every country should think of the FCTC as the ground. I mean, we always have to ask for more. We have to go farther on than what is in the FCTC. One of the things we are actually trying to not implement, but at least to get convince or government to do is work on the first tobacco-free generation. I think that the only way to end the pandemic of tobacco is just to stop the people in getting addicted to nicotine, and that's the young generations. The young generations, the kids today who have never tried tobacco and are not addicted should be able. Won't really miss tobacco if they never try. They are not addicted. So I think the solution is don't let them buy tobacco when they become adults. So I think that's one of it's an end game policy, and I think it's a pretty good one. Obviously, we would like to also decrease the number of point of sales in Spain. I think that the best way to do that is banning the vending machines where tobacco is sold. But yeah, as I already say, FCTC has to be the bottom of all our measures, and we always have to want to go further.
Absolutely, we need to have to continue to want to do more, but realizing that also, unfortunately, as Adriana pointed out, too many countries are still way behind in implementation of the FCTC. And as Martin pointed out, Article 14, it's particularly one that has been particularly neglected. So, Martin, what would be the recommendations in the context of COVID-19 for governments? And for example, one of the attendees just wrote that, for example, cessation councils at Mayo Clinic, and as they expect others also, are doing a lot of one-on-one counseling via Zoom during the pandemic. And it seems to be working well. Are there things that, and you mentioned some low-cost interventions, and what is the very minimum that a country, even with very little resources, should do? And even what could argue in your mind, what even are the obligations under the obligation to respect the right to health that governments have? What is the minimum that governments should do towards smokers who want to quit during COVID? You're muted, Martin.
Sorry, I got the wrong button. Right, sorry. Well, first of all, as I said in my presentation, but it was poor quality in that particular bit, I think. Make sure that in our messaging now, and in our publicity now, that we're reminding smokers or tobacco users there are lots of resources and support available, including medications. Yes, I mean, the idea of using Zoom for one-to-one counselling is terrific, but let's remember that the vast majority of countries have very limited access to cessation support of any kind. I think that those are the main things. Telephone quitlines are an obvious source of counselling. But again, of course, not all countries have them. Text messaging I see as being potentially important. Text messaging systems could be got up and running very quickly. They're extremely cheap, and high proportions of tobacco users have mobile phones. So that's my immediate shopping list.
And what about civil society? This is an area, it's been one of the articles for which civil society has not done a tremendous amount of advocacy. Do you think there is a need for us to call on governments and putting the pressure on governments, in addition to all of the other measures, to also really address and do more to push for access to cessation?
Absolutely, definitely, yes. I think we need to be, again, as I said in my talk, I think we're doing rather poorly in implementing Article 14. I think the Article 14 guidelines have been largely ignored since they were published 10 years ago, and we really do need to do much more in promoting them.
And well, so we're getting very close to the. We have just 1 minute left to the webinar before we wrap up. I was wondering, Adriana, if you have a last message you would like to share with those in attendance, given that we do have, even though we have 1 year for the COP, but there's a lot we need to do in between, even though the delay in COP. What's your message to civil society and governments who are listening in, and what can we do? And one of your comments suggests already is as many of us should become observers to the COP. Would welcome your message to us.
The government is what we were discussing. Please remember that tobacco is needed to improve the result of the pandemic and to have a better recovery when you, for example, apply the taxes. To civil society, we need you, okay? We need you. There are many things that we cannot do and only civil society can do. For example, in the question, civil society got the medication for HIV, a very high and expensive medication, and you got it. You get the way to get it for the people. It should be much more easier to get this medication that is cheaper than those ones. So we need you to keep on countries, let's say, remind the countries of the things they need to do, because they have many things and not always they can put the attention in all the things if no one is reminding them of that.
Thank you, Adriana. And I want to kind of echo this and remind everyone that it's really our duty to remind the world that the FCTC is a best practice tool really to accelerate the Sustainable Development Goals, not only the target on NCDs, but many other ones. It's also an accelerator to achieve human rights objectives. And really the work of the FCTC with the work of the UN Development Agenda, the work of the Human Rights Council are really mutually reinforcing. And they really have to maximize on this tool as a global community. It's really would be a shame if tobacco remains 100 years from now a development issue that we have not yet addressed. In my mind, it is one that we can really, really solve during this in the next few decades. So we're going to be closing in a few seconds. I encourage you to join us tomorrow. We have a webinar hosted with Framework Convention Alliance, which is on closing the funding gap for the FCTC implementation at the global and national level. We know that some of the biggest challenges when it comes to implementation of the FCTC, it's obviously industry interference, but the second biggest challenge is a lack of resources. And given the cost effectiveness of tobacco control interventions, it's something we should be able to address. And unfortunately, we have not yet done that. So I really encourage you to join us tomorrow at the same time. If you haven't registered yet, the link is right there on the screen. And so thank you very much. And I would also really extend a heartfelt thank you to the panelists for joining us today. Thank you very much.